Testing. Yes.
Really digging into the state.
Morning. Scooting around.
We're just waiting.
Yeah.
Treading water.
Yeah, I mean.
Sun's coming. Wisconsin.
What?
All today.
Good morning, everyone. We'll just wait for a few more minutes.
Hard. With the IQ. Morning, guys.
Yep.
Anybody hear us, see us? So I feel
We can
like
hear
Tom-
you. You're good. You're
I mean,
good.
right? Please see me. Tom, you have it. Pinball was. So there was an article in New England Journal of Medicine on wearables in cardiology.
Yes.
Didn't speak a lot about sleep. It's apparently a new series.
Digging into the heart rate variability and stuff like that.
Yeah, they got beats that occur, 60 times a minute, so they can do all sorts of computation stuff. Breathing occurs like 12 times a minute, so
We're at a 20% disadvantage.
that's true. No, and you have to get 80% more data. Have it not move, be right back.
How are you?
Good,
Good, good, good.
that's your right.
Yep, that's my ride. All right, let's see. (8:03), we'll wait for 2 more minutes. We'll start promptly at 8:05. Does that sound good, Sushil?
Sounds good.
Right. 2 more minutes. Hey, look at me, not that, okay, got it. All right, good morning, everybody.
Good morning.
Good morning. So we got a full house here
Morning, Keith.
at Boa. And then probably about 20 or so online. So I guess I don't need much of an introduction. I'm Eric here. One of the sleep attendings here, and I'm gonna talk to you today a little bit about our grand rounds, and the title is #sleep technology. All right, and our emailed out, unfortunately Xavier missed out the hashtag. I was, man, you need the hashtag. So anyway, let me look it up. So basically want to talk about a little bit more about like all these technologies that are coming out. How do we know what's good, what's not, or even just from the very basic, is it really doing what's supposed to do, or what it's claiming that it's doing? Have at least some basic ideas. Okay, so the objective today, I want to introduce a few technology devices / potential apps that are available now. There's like literally thousands of them, okay? And educate ways to review these things and review them quickly, to some degree be able to advise our patients and get familiar with these resources so that you can quickly access them, okay? So in spring of 2020, ASM Montage had this statement there: the sales of digital health tracking devices are expected to total $10 billion this year. And this was already 3 years ago. You can just only imagine this exponentially growth. And that then was 64 million devices sold. This technology tracked everything from steps to sleep. And so we expect to see them very frequently or more frequently in use by their patients, which to our experiences is definitely true. So there was a little interview in Kat Ghosting, Marion Deek, and I thought this particular scenario was very interesting, and which is very true. So Dr. Ghosting was saying, I was taking care of a patient with obstructive apnea who used CPAP for years without any complaints regarding the quality of his sleep with CPAP or any daytime dysfunction. And he received a wrist wearable CST consumer sleep technology. And became fixated on the fact that the device reported an increased amount of light sleep. I could not get an answer from him in regards to how he felt subjectively, despite never having problem in the past. Well, he got a new CPAP machine, which required face-to-face adherence. His insurance company tried to stop coverage of his CPAP due to a lack of benefit. When the patient was notified of this, he finally said, of course I benefit from CPAP. I can't live without CPAP. But that really reminded her that when people can quantify their health, they might weigh this data above and beyond how they feel. When the data is not necessarily correct, this can present problems. Definitely has come about in our day-to-day, clinical settings, and people come in, and sometimes I even heard people coming in, and then it's not until the third visit, I said, why are you so fixated? I said, well, I just don't understand why my wife's sleep number, like sleep number, bed numbers, her score is always better than mine. He was just being competitive, even despite that subjectively, he was actually feeling pretty good. Yeah. So I wanted to show you guys that this ASM committee, which Dr. Ambrose Chin and I are both involved in, this the emerging technology. You do need to be a ASM member to have access to it, but then it's under clinical resource. If you toggle to the right here, emerging technology, you log in and you go to that side and you can explore around. And I'll show you a couple slides of what that website looked like. So even during clinic, you can fairly quickly access this information. So it's hashtag sleep technology. And then when you go in, there's a landing page, and then you come into this part, you'll see sleep technology happening orange, and you click into it. Then you got this pretty nice research search bars here. You can search by name, search by platforms. Typically the platforms will be Windows, iOS, and Android. Okay, so platforms are talking about apps. Types is clinical or consumer. Tags is a whole bunch of tags in there, can help you easily kind of sort out things if you're just wanting to do a general research. But if you very specifically want to research something, like Netflix, I'll talk about what Netflix is in a second, but you can just type in the name in there. So before going into that, one thing I think we need to address this again, and I believe, if I remember correctly, Dr. Chain's presentation about a couple months ago did mention about what's the difference between FDA register, clearance, and approval. So I just want to mention that again. Basically, FDA register, any kind of wellness devices or apps, mostly consumer facing. And it's not even a must, so like they can sell their things, they can put their things on the market without FDA register, but that just depends on the target audience or target market for this particular device. But FDA register is mostly consumer. And clearance versus approval, well, basically the biggest measure is safety. Okay, so if it's something fairly non-invasive, like a diagnostic or even a therapeutic device, something, a home sleep apnea test or whatnot, they're non-invasive, typically carries a lot less risk in terms of safety. They need to have FDA clearance, and then FDA approvals will be something more invasive. So for example, if you want to implant something into someone, that will need an FDA approval. And then that will require many more clinical trials and all that before it can hit the market. And also note that there is something called software as medical device, SAMD. If you look at the bottom here, may have clear FDA clearance, and that a non-FDA cleared device may use a FDA clear software. So, including inclusion, exclusion populations and all that. So that's just something else to consider, because, as nowadays, it's usually not just the hardware, but how a software goes with the hardware, like that. Okay, so there's also other things about 510K diagnostic or de novo devices pathways. So those are other things which was outlined very clearly and nicely in one of the things about novel devices that's on the ASM website. Okay, so we're gonna jump into our first guy, Fitbit. So there is a lot of different kind of Fitbits, as you can see, big ones, small ones, white ones. So there's a lot of stuff that's done around Fitbit, and you probably in the fellows, have you had patients talk to you about Fitbit yet? Their Fitbit already, right? And you've been doing sleep for like what, 6 months? And then they're already like, how come this? My Fitbit says this, my Fitbit says that. I was just like, what does your doctor say? But anyway, so there are many researches done with the use of Fitbit devices. They actually have a Fitbit research library on their Fitbit website. It actually has close to 1,200 different research, or at least papers that are done with Fitbit. I kind of did a quick research on it, probably about 80 studies that were specifically related to sleep. All I did was type in sleep and then counted how many there was. There were studies about validations of sleep stages. to the actual PSG. There is the validation of, the heart rate counts against PSG and all that. But if you can see, this is a typical page of what a hashtag sleep technology page will look like. It typically has a summary, has a claim capabilities and the mechanism and what type of sensor they uses. So Fitbit Charge 2, it had basic.
This is on the ASM site.
That's correct. That's correct. And then
Fitbit site.
right, not a Fitbit side. So on the left side, this is that. And so basically it'll give you some websites, categories, and kind of put it down and whether or not the raw data was accessible. So Fitbit Charge 2, I think this is pretty important over time because even between Fitbits, they use different mechanisms. But with Charge 2, it uses a motion sensor and the heart rate, basically using a heart rate variability, using that with their own algorithm to come up with their quote unquote sleep stages, their quote unquote deep sleep, and Fitbit Ionic uses plethysmography, 3-axis accelerometer, and vibration sensor. Appear that it may be a little bit better compared to the prior generation. So Fitbit Ionic, they claim to be able to not only estimate sleep duration, but also sleep stages as light sleep, deep sleep, and REM sleep by detecting the movements and all that. So just a real quick, basically hashtag sleep technology is not meant to kind of tell you this is good or bad, but tell you what it is, in a, very quick way. So I just highlighted 3 different, papers that was done with Fitbit, particularly validation papers, sleep staging and in athletes like Fitbit Alta, okay? And then middle one, comparing the accuracy of sleep staging data from Fitbit Charge 3 and Fitbit Charge 3 against PSG, measuring sleep in adolescent boys and girls.
This is from the ASM?
This part, no.
Okay.
This part, no.
Just
Right.
clear.
Yeah. So this is part, ASM points you to their research library and you can dig a little bit more into it. Because there's just so many for Fitbit, I think that's why they couldn't summarize it. So generally, when I kind of take a quick glance of these, Fitbit is actually surprisingly good with sleep duration. But sleep staging, not so much, depends on the study and I almost feels like you need a meta-analysis to actually really sort this out to verify whether staging is good enough or not. But sleep duration wise, I think it could be, before we really figure out all the activity stuff, if patient really is suitable, that may not be a bad choice to kind of just advise them. And then we try to see, but just take that in mind that sleep duration is really what we're looking for. At least from the studies that I pulled up, I feel like sleep duration is generally pretty spot on compared to PSG. Staging, not so much. All right, so another one, Oura Ring. Who has heard of Oura Ring? Oh yeah, a lot of people have heard of Oura Ring. It's a nice, cool ring. Look at that. That's one of the 7 colors. 1, 2, 3, 4, 5, 6. No, 6 colors. This is rose gold, right? Rose gold is always good. That's what Apple uses it. So anyhow, so this is another one which also was reviewed. They have their claim capabilities, uses basically tracks using heart rate variability, interbeat intervals, resting heart rate, and so to track and to come up with sleep stages, sleep timing, durations, and all that. So it's just a very tiny ring that you just put it on you, and I have seen at least 5 of my patients having it, and then coming in, and then sometimes they print out the paper, sometimes they just show me their phone. It's like, "Doc, do you want to see all this?" I was like, "I really don't have time, but yeah." So claims to use the data to help users with the in-depth sleep improvement programs and personalized circadian rhythm alignment guidance. So next one, there are some studies, and then that I just pulled it out from the hashtag sleep technology for the ones with not as many studies as Fitbit. They will highlight out like the more important papers and actually have a summary for the paper down. At the end of this presentation, I will actually hop into the website and just show you guys something real quick. So They also got comparison of Oura Ring tracker against PSG, estimating sleep. So one very interesting thing is that there was a validation of 6 wearable devices as things estimating sleep and do it all at the same time. I thought that was pretty neat. So that particular one is a study that was done, I think 2 years ago or something. They put 6 commonly used wearable devices on the patient at the same time while they have the PSG. So they put the Apple Watch S6, Garmin Forerunner 245, Polar Vintage 5, Oura Ring Gen 2, and Whoop 3.0, which I don't know if you guys know Whoop, but it was Roy McIlroy, the golfer, is the representative for it or whatever. Some fit to assess, and then but quite interestingly, they all came up as far as estimating sleep is concerned, fairly okay, you know. So, but I just thought that how can the patient have 6 different devices put on them for the whole night? All right. So next one, sleep number beds with sleep IQ. There's something that's big, right? Patients come in and patients sometimes get, oh, doc, my sleep is going to be so good. It's going to take a turn. It's going to take a turn right now because I'm having my sleep number bed coming in. So what is sleep number bed really about? Basically, it has sensors and it tries to adjust, but it doesn't adjust automatically. It gives you guidance to do that. So their claim capability, just gonna read it out real quick. The sleep number bed with sleep IQ is a foam top mattress with air bladers underneath that adjust for comfort. The sensor incorporated inside, but you must use the sleep IQ app. Feedback integrates the information you put, including exercise, caffeine utilization, and sleep goals. And your heart rate and respiratory rates are detected by sensors as well as information from paired devices. So you can use sleep number beds and pair with Fitbit, Apple Watch, etc., to provide suggestions regarding mattress firmness. And for example, like adjusting after a long workout or whatnot. And sleep hygienes, they will also suggest you that, which is never a bad idea in my opinion, and temperature. It provides sleep IQ score of 0 to 100. So that's where the competition begins. But there's no target score. It's meant to look at the trend rather than absolute value. Provides daily sleep IQ score, monthly emails, tip to improve your sleep. Does not automatically adjust the bed firmness or temperature in response to its finding. Can raise the head of the bed to decrease snoring for the bed partner. So just kind of imagine if this is your first time seeing a patient like this with these concerns, then you pull up what you need. This is a very quick read, you know, maybe half a minute to a minute, and then you have a pretty basic idea of what sleep number bed is about. And their claim capabilities on the left side here, that smart bed with sensors and adjustments that claims to help you sleep better, claims to measure your breathing, heart rate, restful sleep, and restless sleep, and wake after sleep onset. It tells you all of that. This is quite honestly TMI. There's too much information for a lot of our patients. It's kind of scary, you know, but that's what we're facing too, you know. So let's go forward.
Is that FDA?
No, it is not. It is not. Okay. And when you pull up that from the ASN website, you will see whether it's what the FDA status is. So I talked about this with a couple of my fellows. It's Ergo Night. I think it's very interesting. I just want to show you guys what this is. This is the device that I reviewed. The basic idea is that it is a device where you put it on your head when you're awake. And the target training time is about 20 minutes a day. All right. And then the idea is to train your brain to produce a particular type of wave called SMR, sensory motor rhythm, which is between 12 to 15 hertz, which was found kind of coincidentally to, you know, somewhat improve sleep or the ability to fall asleep. So basically it's adapting a neural feedback idea to be able to train your brain to think a certain way, to imagine a certain thing so that your brain can produce that. So it's a daytime training, and it's a training with wearing this little crown on your head and with the app that the app is supposed to track real time of what your EEG signal is. And once you're able to produce, for example, if you slap yourself out, that actually hurts. Slap yourself, and then it becomes, you know, you have that 12 to 15 hertz, then they will give you a cue. Good, you're doing the right thing. Think about certain things or whatnot. It has some training aids with both visual and audio cues. I thought that was kind of neat. It claims to be pretty good, so let's see what it claims. Euro 9 claims to improve sleep satisfaction by increasing sleep as much as 2 hours. Waking up refreshed, wow. Seeing results after 3 weeks of training and having long-lasting effects up to 6 months. It claims to train users to produce more brain waves that are associated with sleep, to provide customized training, be scientifically proven, wear nothing to bed, and be a non-habit forming, have no side effects, and not emit waves or sounds. But claim that they do not actually claim this to be a medical device. So therefore, they did not use the FDA clearance or register even, because they said this is not a device, you know, because it does not actively send any shock to your brain or your head, you know, it just takes information. So I don't know how you feel about that. I feel like that was a little much. So anyhow, as I sort of explained, that it is a wearable EEG headband connected to an app and has 2 dry measuring electrodes over the sensory motor cortex in position C3 and C4, and reference ground position to the left and right mastoids. The headband data transfer in real time, in which they have a validation study between the actual headband and the PSG EEG or EEG, and then the EEG signal that the headband captures is fairly accurate. To allow users to perform independent neurofeedback training. In addition to the neurofeedback program, app provides daily sleep quality and sleep hygiene advice, questionnaires, and sleep diary. The app also allows users to track progress, set goals, and set device use reminders. Developed as an at-home neurofeedback device, claims to improve sleep quality through SMR neurofeedback training, and user will just connect to the app and like what we discussed, 20 minutes during daytime. And this approach reportedly targets the reticular thalamocortical circuit associated with sleep spindle generation, claims that users learn to produce sleep-associated brainwaves using biofeedback training with the app's visual and audio cues. There's an online support group of the Ergonomics. There are industry-affiliated publications. It is not FDA cleared. The website claims that the Ergonomics is not a medical device and not designed to treat any medical conditions. That's their website. So, but they do claim, so we can perceive sleep signals while we're awake, Yeah, John, that's exactly what they're saying. So, you know, hashtag sleep technology is not supposed to say, I mean, it's not designed to say good or bad. We're just gonna tell you what we find, and then you figure it out. So this is what it looks like. I took this directly from their website, okay? And then basically just, you know, the sizes of it, and, you know, these are some things that you, some electrodes that you can replace and all that. Comes in a very nice marketing package. It is $500.
That's not bad.
It's not bad. It's not bad.
$300 for a watch.
For the headband, right? So a couple studies that are done on the overnight. So I put it out there, was an open label feasibility studies. So primarily the way that they come up with, you know, its improvement for sleep and sleep quality is by the Pittsburgh Sleep Quality Index and HSDQ. And then the other one is a study basically mainly on cognitive functions. And then obviously the last one there was actually the first one that they did is to make sure that the EEG signal collaborates. All right.
So they say it's not a medical device.
No.
And the middle reference there talks about cognitive functions in adult populations and sleep problems.
Right. So they did a research on it, but on their actual marketing, they don't claim it to be a medical device. Yeah. And then, but they tell you it helps you with your sleep, but it's not a medical device. It's not supposed to treat your insomnia. So those are the things where, I think the more we understand, the more we're able to help the patients.
We're trying to do CBTI with herbal treatment. I can't use a little bit.
Yeah, kind of. I mean, so Stephanie says, I wonder how many of these technology are incorporated into federally funded studies.
I bet they're merging into them. I mean, there's a lot of interest in these things, but you just have to have a really good design stuff. Really good design.
Yeah.
Complementary, no, it could be complementary, but it's just not.
Right, so I obviously know Ergonomix a little bit more because I reviewed it myself. So I just thought there was a very interesting idea about treating, particularly really insomnia in this case.
Did you try it?
No.
Well, that's fine.
All right, let's buy them. Oh, here's another one. This one is called Dream. So Dream is a little bit different. Dream is technically both consumer and clinical facing. So what Dream does is, in the summary, Dream 2 headband device is a wireless headband worn during sleep, which records, stores, and automatically analyzes physiological data in real time without any connections. Well, physical connection. Connects to Bluetooth and Wi-Fi. Oh, without any connections. No, sorry. So no Bluetooth, no Wi-Fi, my bad. Following the recording, the DH connects to a mobile device, and by a device, it transfer aggregated metrics to a dedicated mobile application, or to sponsored servers. Users can view sleep onset, sleep time, sleep stages, position changes, awakenings, and heart rates. Users have access to sleep onset relaxation programs and audio and coaching library. The Dream Coach that offers alerts for changes in sleep onset, sleep time, wake time. And then they have next version, Dream 3 has been used in biopharma sponsored studies and validated against PSG. And then not just 3, the Dream 3S. I feel like they're just really not original. Whatever Apple does, they do. Dream 3S is FDA cleared on August 18 last year for automatic event detection software for PSG with EEG for adults between 22 and 65. It measures, records, displays, transmits, and analyzes EEG at home or in a healthcare environment. Its FDA clearance includes automated sleep staging scoring, hypnograms, and summary of sleep matrix. I think this is pretty wild. In a sense that, when I look at this, I was like, well, can I have can technically have a home sleep apnea test with the EEG detection, and that's all
It
automatic.
doesn't say it's a sleep apnea test.
It does
just
not.
says that it's a sleep.
Right, it doesn't, because it's only a EEG,
Right.
but it automatically detects that.
Yeah, this has been in the wind for a while.
Yeah,
And insomnia people that have had this before just couldn't get traction.
right. So
This has been used in other countries for testing of sleep aids.
right. I think it's pretty neat, and
Specifically Japan.
right.
So the big pharmaceutical.
So as you can see, the Dream 3S is now FDA clear, right? Because it's gonna be used for some degree of diagnostic purposes. So that's that requirement there, but it does not need to be FDA approved. That's not the type of approval they need to seek.
Yeah, you gotta be careful on diagnostic. It's just a physiologic monitor that
Right.
you could use in trials in which people already had a diagnosis. I don't
Right.
know. You wear them, you could tell a person has insomnia.
Right.
Because that's not the disorder. Disorder is somebody that feels bad.
Right.
But I think that that's what the utility of this is to sort of get some sort of idea of what their EEG things are. I mean, for instance, spindle density is found in schizophrenia. Would you use this to sort of say, the schizophrenia medicine doing better with spindle density?
Right.
It's possible. It's interesting.
Yeah. No, I think it's a very nice add-on, Let's see. one more chat here. I see a lot of Fitbit studies on sections I'm on, yeah. All right, so,
So let's come back to the statutes, things about fitness.
right, so Dream 2 offers sleep coaching and claims the users will fall asleep 91% faster, of 91% of them faster, 78% of them feeling easier, and have less sleep fragmentation, have access to accurate sleep staging, heart rate, respiratory rate, and have access to weekly sleep report, tailored sleep coaching, bone conduction audio system, a large audio library of sounds and coaching, and in-program calls with trained sleep experts. Ooh. The data provides a complete sleeper profile to review quantity, quality, and pattern of sleep over time. Dream 3 is a lighter, more advanced headset with improved EEG signal quality and uses AI-driven analytics to reportedly provide sleep metrics comparable to PSG. So that's their claim. And again, there was a notable study. There were many, actually quite a few studies on Dream. I pulled this one out. The Dream had been performance of signal acquisition and automatic sleep staging algorithms were compared to a PSG, and 25 subjects were both the Dream headband and PSG results. The mean percentage error between that was about 15%. The mean absolute error for heart rate, breathing frequency, RV was 1.2, 0.3, and 3.2 respectively. Automatic sleep staging reached the overall accuracy of 83.5. That's pretty decent for the DH to be compared with an average of 86.4 for the 5 sleep experts, like interscore reliability, I guess. The author concluded that DH accurately signals and determines sleep stages. So that was a study done in 2020. Sorry, probably 2019 something. Let's see. Okay, all right. So a little bit more. All right, a little bit more. So this guy is called Relaxis, and so what it does is that it is a there's not many ROS devices out there that kind of will help you to treat or control ROS. You know, the first thing we think about, obviously, hopefully, is iron. And then, you know, with our, you know, gabapentins and stuff like that, and, you know, then to our dopamine agonists. And then that's, you know, typically our way to go. So this thing came out, and then there's probably some people were using it and brought it in, and then this became available on the market. All right. So basically it's using a vibration and frequency and rhythms to kind of treat, to help to relax the leg at night. So, and FDA approved this for treatment for primary ROS. Relaxis is a non-medication alternative that can be used alone or with ROS meds. Adjunctive use of augmentation is unknown, visually looking like a heating pad. Relaxis delivers 30-minute cycle of vibratory counter stimulation to the leg. Devices, precautions, and side effects appears low. Although studies were multi-site, the number of patients was 159, and many publications appear to be from one group or the inventor. All right. So what it does is uses a leg press that deliver vibratory counter stimulation. So when you look at this, so what happened is I kind of pulled it out. I wanted to see, you know, we talk about, Dr. Chang talked about like the new OSA treatments, like the bongos and, you know, the INAP and stuff like that before. So I didn't include any of that today. And then I just thought those interesting headbands or something were like, do they really exist? And I was like, yes, they do, you know, and then they are commercially available. And I thought I would try to, and then, you know, insomnia, obviously there's a lot of apps that are being reviewed, a lot of things that have their claim capabilities. There's just too many. So I thought, oh, what else? I tried to look up parasomnia. There's nothing to treat parasomnia as a device. I don't know, probably you need something to kind of tie you up. I guess that would be something. But then RS, this was the only one. So I got interested, I get in, and then the website was right there. I click into the website and I was like, it led me to nowhere. It says that this domain is up for sale. Okay, this particular Relaxis was reviewed in 2019. Okay, so I guess, you know, hashtag sleep technology will need to update it also, because what it is that then I researched a little bit more. It says Relaxis for RS is discontinued. According to that website, that place, I believe is Sleep Review, said that it's discontinued because Relaxis is trying to get this covered by insurance, and CMS refused. And CMS claim is that anything vibratory is for pleasure, not for therapeutic. That was what they put down on the website. I thought that was kind of an interesting claim. But anyway, I think so I think what it is that it's easy to have, I mean, it's convenient to have it on the website, on that hashtag sleep technology, so you can see if this was being reviewed or not, read through, and just the website is right there. You just click on it, and then it might lead you to some other things. And for example, there was another devices that I was reviewing, and as I was reviewing, an FDA, kind of warning or / recall popped up. So I was like, oh, those are interesting things to know. And patients may not know, right? Look at how many patients coming in with their drug stations, not knowing the recalls at all after 2 years, but these are the things that, hopefully we can stay in the know and then be updated that way.
You can buy it used.
I use what?
Used relaxers.
Oh, probably. I'm sure you can look them up on eBay. I'm pretty sure. So anyhow.
You're not supposed to sell.
Are you not?
Well, I guess it's not a medical device, so you could sell.
Right, right. So there are many, many more of these reviews that are available on hashtag Sleep Technology. I just felt like there were too many to try to review, and I think today the presentation is really aimed to get you guys kind of a sense of what these things are and how do you find them. So the Philips Smart Sleep Deep Sleep Headband claims to help you to have more slow wave sleep, whatnot. And Smart Nora on the bottom right here, sorry, I have them a little bit small. It is a device that it is positioned underneath your bed, all right? And then when they detect snoring, it's supposed to kind of have an automatic wedge to make you turn to your side. I thought that was pretty neat. And then Calm, it's an app that has various different things, and Muse is another real-time biofeedback, neural feedback devices that kind of put on your head. It just seems like we put more and more stuff on our face, starting with the CPAP mask and with, Bongo and everything. There's a lot that we can do. And the reason why I put Netflix in the middle, it's interesting. You know what Netflix is about? It's just like Netflix, but it's supposed to play you something super boring, play you something really calm, and basically help you to take a nap. And yes, people do think about it and actually came up with the name Netflix. I thought that was wow. So anyhow, that is actually all I have today. I think I will open this up for questions, comments, or anything.
So really, major thing is that there is an AASM site in which somebody comes in, see whether or not somebody has reviewed it, or that there's some information on it. Doing those sort of things. Who's that doctor over there? He looks so white, he looks so old, he looks so male. Okay, looks so AI, right?
So just wanted to show you guys this as well. If you log into the ASM website, hopefully it didn't log me out.
Should have Sushila.
Shoot, it didn't log me out. If you go to the clinical resources here and you go to the emerging technology and you hop in here and then kind of scroll down hashtag sleep technology, and that will take you to, let me sit down, can't stand too long right now. Take you to this particular site, which I showed you before. And then, so platforms is this, type is this, and there is a bunch of X. So if we want to find out a little bit more about Netflix, all you need to do is go in and it will have it right on. And when you open it up, it's a very simple page like
It's like,
that.
you don't fall asleep because you're bored, you fall asleep because you're sleeping.
Yes,
See, so someone who's writing this was, it's just not being very precise.
right,
And if you're not sleeping, you're bored, you do something else. You throw spitballs,
right,
you make notes, and you think about what you're gonna do. So it's really, what does it really try to do to put you to sleep? It tries to try to be distracted. And I think John's idea about can you really auto project a spindle is really quite interesting. You should think whether you can take that technology and look at it in an MRI and see if you can actually cortical echo by just thinking about it. That sounds like an interesting.
right.
So Stephanie, you said you've seen some stuff on study sections. Fitbit. Has it been, what do they do? How do they incorporate it in? I don't know if she's still. It's Dr. Griggs. She may have come on.
Yeah, she may have. All right. Any questions, comments? Hi, Dennis.
Yeah. Hey, Eric. Yeah, nice talk. So, I'll just throw in there. So I was part of the original task force that, on diagnostic testing for the ASM, and, we made, guidelines for what's appropriate, for home testing for obstructive sleep apnea. So focusing specifically on that and not so much the staging and whatnot. And because of that, the rapid explosion in testing devices, the ASM reconvened a group to do a focused update on just the HSAT issue. And because these things are coming out so quickly in terms of, what is really appropriate and what's not. And I have to say, you did a nice job of just pointing out how fast the technology is moving, but the complexity of this, and we're really struggling with a lot of issues related to this. For instance, should home testing devices include oximetry? Should that be a requirement, since that's how we're currently scoring sleep apnea events, and that has to do, a fair amount of data about prognosis associated with hypoxemic burden. But there's a whole, we're in the process of just screening abstracts right now, and it's just amazing the amount of things out there, the artificial intelligence being utilized. All these things are algorithm driven, not necessarily devices. And so in any event, we're hoping to come out with something. It'll probably be because of it was supposed to be a fast review, but it's because of just the complexity of it all, it's probably going to take a bit longer. So probably in the next year or two, we'll have an update on current available devices, but the hope is it will establish some sort of criteria for what going forward, what might be the necessary steps that devices have to take to be, sort of considered adequate for OSA diagnosis. So yeah, so it's kind of an overlap with the emerging technology, but a really focused area.
Right. That would be great. And, we look forward to an update on that, because like you said, there's just so many, I didn't even dare to touch that part in the review today because there's just too many of them.
Yeah, one of my concerns is that as soon as we publish this, it's going to be out of date. So that was part of the reason we were talking about just at least setting some ground rules for what might be considered acceptable. And I was sort of hoping Ambrose was going to be on the call today, because he's really, along with you, expert in this area, and he's on the task force as well, and is really helping out a lot. So anyway, so that was my comment, but thank you for the talk. It's very good.
Cool.
I guess I just wanted to offer an opinion and also kind of seek the group's opinion on this. It's a little bit of a sky is falling scenario. The question is, what is the role going forward of the sleep physician, and how do we future-proof ourselves? And the reason that kind of question and concern comes to mind is, as you pointed out, we're seeing a rapid explosion of technology across different spaces that intersect with sleep. That technology generates lots of data. big data is kind of the future of how we do research now. It's pretty obvious that the data sets owned by, Fitbit and Google and so on are rapidly outstripping kind of the sum total of what we have in the sleep medicine, research library. And couple that with the kind of public interest in sleep, every celebrity and influencer and so on is talking about sleep and sleep health and sleep hygiene, and maybe that's good, but ultimately I think it potentially represents a real erosion of expertise. So I don't have an answer to this, but I'm curious, if people have thought about this, where do we see the field going in 15, even 5 to 10 years? Are we just going to be sleep disorder specialists, or do we have a role in the sleep health space?
John, I've been thinking about this a little bit because I keep thinking about where the field is going to be and where it has to be. And I think the first thing you do is you're an MD and you can prescribe drugs. So we're going to be asked a lot about whether or not drug therapy or alternative therapy can improve people's symptoms and disorders. And then the other is that hopefully our training is sufficient with 1 year training going out to be diagnosticians for various things. And the third thing is, I think in insomnia, we've now gotten to know that there are 4 or 5 different disorders underneath insomnia that need to be distinguished. Delayed phase, advanced phase, etc. And so chronobiology. So I think we have to first of all broaden our expertise. Secondly, we need to be, to me, I think we need to have new stuff. I mean, I think we've been using the PSG lab the same way now for 25 years. And that the MRI is not, right? And so is it going to be for, and the more things that are out there, the more indications there are going to be for very odd things to come through. And I don't think it's covered by 72 hours of inpatient monitoring for an epilepsy. I think it's going to be 8 hours of 16 channels of data to look at the brain. So, 128 electrode array in the sleep lab to be able to detect, things other than just sleep apnea. And then the last is, all the things that we do for sleep apnea that I think need to have supervision. So I mean, I think that that's really where it goes. We're still going to have this attitude that we're an outpatient driven specialty, and that we don't open a left main artery. We don't replace an aortic valve. We don't do those sorts of things. And we don't have a lot of urgent sleep disorders that need to be treated because people will die. We usually just are picking up after the pieces after a car accident or something like that. And so I think the idea of what you do with it. So I think chronobiology, I think chronopharmacology, chronobiology, other, the idea of obesity management according to chronobiological issues are going to be something that Phyllis Z is pushing the envelope for circadian rhythm clinic, things of that sort. I think that's the expertise horizon, and that we have. I mean, we got now. We got a big enough textbook. We got a big enough textbook to throw it into the other specialties that have. I mean, we need a biologic, right? If we had a biologic, we would really, really do those sort of. Maybe we could monitor the biologics in Alzheimer's. We really haven't gotten into it, but that's sort of like what I'm, because I'm essentially worried that I think I was told when we had the HSTs by somebody in cardiology said, don't worry about the HSTs because you'll still be doing just as many PSGs. And that's true. And really, because more people are doing HSTs and asking more questions and asking more things, it's more available. And it's still going. I mean, still, even in our group, the estimates are that only like 30–40% of the primary care physicians order like 80% of the PSGs and HSTs. So it's not gonna go away, it's just gonna be that's what it is, and it's just the attitude, you know. You say we're interested in sleep and people say, oh yeah, I got my Fitbit here. And you can't print out the Fitbit, so I can say, can you tell me what it's been for the last 12 days? No, I can't. Now, I think you can now, but you have to ask Fitbit to do it, right?
Yeah, you have to be able to access their phone, but it's pretty readily available though, if you wanna look, really.
Well,
So,
maybe
yeah.
in clinic,
Right.
20 minutes to look at their phone, be able to print it out, come on.
That's tough.
Can't do that. I mean,
Yeah.
that's sort of where I'm thinking about.
Yeah. Yeah, interesting how technology just brings us think about the future, right? So, any more questions for this morning's grant rounds?
Yeah, I think that the issue is these people trying to get consumers, and they know they can get more money out of being at medical.
Right.
And so this relaxes its business plan collapse.
Right.
And so that's gonna happen. I like the Fitbit research library.
Right.
And I think the Netflix, I mean, there are certainly interesting, I mean, alternative and complementary medicine proposals for looking at music and its ability to have you fall asleep. How do you define faster?
It's all a subjective questionnaires, I believe. That's what it was.
Yeah, but I mean, we need to know objectively what faster means.
Just so you guys know, sorry.
I just have one real quick comment, just thinking about this. You know, we have to remember that these technologies are being developed really for financial purposes and not clinical. And we look at these as try to get clinical data from them, but their purpose is not really clinical. It's all financially driven. And, you know, versus HSTs, I mean, that we're using now, there's a disconnect there. So I think we have to consider that as well.
Yeah, Dennis, I think the financials that they have is the reason they have you access these clouds is that they can charge you a monthly fee. So it's probably not just the device itself, it's the $12 a month for your fee to be able to sit there and say somebody is validating or invalidating your sleep feelings.
Yeah, for sure.
I mean, that's what the guys tell me. They say, you know, I could give you a scrap piece of electrodes and give it to you, but if I had a cloud, boy, and I could market that, I'd sell you a lot of stuff.
Nothing new under the sun in a sense where you don't really buy the printer, but you buy the ink. So, all right, thank you, everyone. The fellows here will continue with the IQ case today. If you would like to stay on, feel free, but otherwise, have a great rest of the day and see you next week.
Okay.